can I help you?
Oh, hi. We just signed up for a basketball clinic program for our son, and we're wondering what are the medical screening and assessment procedures that is needed for this basketball clinic.
So basically, we'll be doing two things. One is medical screening and physical assessment. So the purpose of medical screening is to identify any prevailing health problems, risk factors, and symptoms of chronic illness of your child. There are two types of medical screening which we use, which are PACU and AHA, or ACSM medical screening. The more preferred screening is AHA, since we feel that it's more detailed than PACU and more suited for individual with needs.
So how are we going to go about doing this?
So this is the AHA form. Together with your child, you can fill out the form. If there's any red flags, you need medical clearance from a doctor to carry on with the assessment and basketball clinic.
Daddy, Mommy, why do we do this? What is PACU?
This is for your own good. You said you wanted to play basketball, right? I've already given you permission, but first you have to go through some tests, and this is one of them.
Okay, Mommy. Okay, Daddy.
So after the medical screening, we'll move on to physical assessment. This allows us to identify the baseline of physical fitness and motor skills of your child, and to help us program your child's individualized education program, and to evaluate any progress of your child.
Okay. So what are the tests that will be carried out, like what you said?
So for the demands of basketball, your child will be tested on muscular endurance and strength.
Daddy, Mommy, I got muscles.
Okay.
I got muscles.
Okay, sit down,
I
sit
got
down.
muscles.
Sit down, later I buy for you sweet, okay? Sit down.
What's your
Okay. Thank you, Daddy. Thank you, Mommy.
For muscular endurance and strength, we'll actually do several tests, which will be wall sit tests, handheld dynamometer, that is to measure strength, measure arm strength, plank tests, hand-eye coordination tests, cardio tests to check for fitness of your child's heart. And all these things add up to allow us to understand where your child stands in the demands of the sports.
Okay, so after all these are completed, how would you guys be involved in handling my child? Because I don't want him to be sitting around not taking care of himself.
So you actually don't have to be worried about this, because all our staff are trained along with the social workers, and all of them will be there during the basketball camp to help with your child's development.
Okay.
Mommy, Daddy, can we go home now? I'm very hungry.
Soon, okay? Soon.
Okay, so I wouldn't hold your time. Is there any other questions?
For now we don't have. If there's anything we are unsure of, we'll contact you again.
Okay.
Yeah, thank
You're
you.
welcome.
Thank you, sir.
Thank you.
Welcome.
Thank you, sir.